I have a bonus question.
Oh.
Let's see what Scarlett does with this. Scarlett, Dr. Lipson does applied kinesiology on you. Can you tell me what applied kinesiology is?
He digged for bones.
Applied kinesiology is an amazing system of assessment and treatment. It allows us to analyze different body areas and pathways, and we utilize muscle testing, body language. We're able to ascertain where problems are coming from, not necessarily where the complaints are. One thing that's interesting is a lot of times within the body, where the complaint isn't really where the problem is. A couple examples, a patient that had severe foot pain really ended up getting corrected 100% by correcting his jaw, TMJ, and neck. Several patients with various kinds of disorders and problems, when we successfully treat their digestive system, they end up recovering fully.
And after 2 weeks, he threw the painkillers away and he did not have to have the surgery.
The other chiropractor, no results. When I came to see Dr. Lipson, results were right away.
I find that I'm more active than my friends that are my age. I find that I don't get as sick as I used to.
Really isn't a best patient. The best patient are people, because we're all people, we're all humans. One of the goals with treating people with chiropractic and applied kinesiology is we emphasize the importance of balancing them structurally, nutritionally, and emotionally. My goal is helping people regain their health. The healthier that we are, the better decisions that we make, the better we are in our lives, the more able to get out into the world and actually make a positive difference.
I can honestly say that by seeing Dr. Lipson on a regular basis, and I see him at least twice a month, we've been able to keep all of those common complaints at bay. By the use of applied kinesiology, Dr. Lipson can help me determine whatever the aches and pains are derived from.
I first started going to him with a neck injury I had ever since I was 19. It's been a chronic problem. And he's helped me so many times, like when I injure it, I re-injure it. I've been to other chiropractors before him and to no avail. They just didn't help. And he works magic.
Has Dr. Lipson helped your belly? Yeah. What do we have a lot less of?
Accident.
Yeah, we do. And how does your belly feel? Does it feel hard or does it feel soft now?
Soft.
It feels soft now. Now, do you have more energy or less energy now?
More energy.
More energy, you do.
The chiropractic that I tried made me feel very good, but it only lasted for a day or so, and then my joints and things were back not feeling well. She suggested that I speak with Lanny and talk to him, and we tried kinesiology. I haven't turned and looked back.
I have problems sleeping through the night. I have problems with my digestion pretty much every day, and I also have issues, I think, with my hormones. I have these terrible mood swings.
Okay, we've actually had a lot of success with hormonal types of situations, which could account for a lot of what's going on. So we're going to take a look at a few things. The first thing we're going to do is look at your posture if you'll stand, and we're going to just check positions. You actually show a slight high head tilt on the right. Shoulder and pelvis are high on the left side. We're going to look at you laterally, and you have a little bit of extension in the mid area. And we're going to have you open and close your mouth twice. And we're checking for any TMJ jaw problems. Have a seat here. We're going to check something called the temporal sphenoidal line. That gives us an indication of muscular imbalances, as does the posture. We're showing a right sartorius muscle, a pectoralis sternal muscle on the right, and we're also showing a sartorius muscle and piriformis muscle weakness on the left-hand side. We're palpating for unusual nodules. I'm going to ask you to lay on your back. So what we're going to do is we're going to check some corresponding muscles by doing some muscle testing. We're really at this point looking to identify any kind of muscular imbalances, especially muscular weaknesses.
Okay.
So I'm going to have you bend here. So I'm going to put pressure this way and you're going to put pressure against me. Okay, resist. And that's showing some weakness. That is actually a muscle that relates to the reproductive hormonal system. Another muscle we're going to test is the sartorius muscle. Resist. That's also weak. That relates a lot to the adrenal glands, which is where a lot of stress factors come from. We also found on the TS line pectoralis sternum muscle. Resist. That's also weak. As we saw on the chart, we have different reflexes that correspond to different areas within the body. We really want to investigate what's behind all this.
Okay.
So we're going to look at that. So what we want to do is we're going to have you put your fingers at the reflex for the reproductive system, bend here, and we're going to do the same test. Resist, much stronger, okay? And what we're going to do is test this, resist. That's quite a bit stronger. When we test this, resist, put your hand there again, and resist. That's still a little bit weak. Take this and touch here, resist, much stronger. Keep your hand there. We're going to go this way, resist, much stronger. We're going to go out, resist. That's much stronger. Take your hand away. Let's see one other interesting thing. When I palpate here, not much.
No.
If I go here, is that sore?
Yes.
Quite a bit?
Yes.
Okay. And if I go here, sore quite a
Yes.
bit? And if I go,
Yes.
that's quite a bit sore? Not so much here? What's this?
Not so
Okay.
much there.
What about here?
Not so much.
Okay. But this was sore. This was sore.
Yes.
This was sore.
Yes.
Put your hand here at this reflex for the liver area. Any difference?
It's a little better.
Yeah, it's less.
Yes.
What about up in here?
Better.
That's less. And that showed and that showed. Take this away. That's sore. We're just going to have you go near there. We're still on the reflex. And is that less?
Much
Quite
better.
a bit less. And again, is this less?
Less there too.
Now we know the beginnings of what we want to do for our treatment. We want to start treating areas that relate to, in a natural way, reproductive hormonal system, liver, gallbladder area. A lot of times, besides doing the reflex work with the muscles, there's a lot of nutritional areas of involvement that we can help with. So we can use natural supplements, which we can also test in order to ascertain what's going to help her the most. Thank you.
What is applied kinesiology? I don't really know. To be honest with you, I don't really care. I just know it works.